Cancer. Just the mention of the word causes your heart rate to increase, your muscles to tense, and your throat to tighten. We understand why.
Last March, I was on vacation with my sisters. One of my sisters, Tricia, had a constant dry cough. She was over 40 and an ex-smoker, so I told her to go get checked out soon. 2 months later, on May 6th, Patricia died. She was only 44. My sister never had a chance against the lung cancer that took her life.
No one wants to hear the word cancer, and it doesn't really matter whether it's you or someone you love they're talking about. When it's cancer, the reaction is always the same: fear. Fear of the disease, fear of the treatment, fear of the unknown. But it doesn't have to be that way. Here at UT Health Northeast, we are changing the way you look at cancer by changing the way patients with cancer are treated. Physicist Tim Ochran helped design the UT Health Northeast Cancer Treatment and Prevention Center. Tim made sure that everything about the center was created with the patient in mind.
One of the things that's unique about our facility is the proximity to the parking lot. It makes it easy access for the patients to enter and leave the facility. Here, as you come in, we have 3 different clerks that are able to check you in. And as you check in for your daily visit, things move along quite well and quickly in this area.
Many cancer patients are receiving treatment 2 or 3 times a week for several weeks or even months at a time. Because of this, each part of the center that patients will need to visit is conveniently located as a spur off of the lobby.
We come into one of our 2 rooms where we have our true beam linear accelerators. We were one of the first 50 facilities in the world to get this technology and have continued to be a developer with the Varian company on this product.
The Varian TrueBeam Linear Accelerator is the most advanced piece of cancer-fighting technology in the world. UT Health Northeast has not 1, but 2 of these $7 million marvels.
We can actually track the tumors that we're treating in real time. We can see where they're at just as the patient's being treated and then make adjustments on the fly. This makes a big difference in that we're only treating the tumor itself and minimal areas around the tumor. So side effects are less, patients are happier, our outcomes are better, everything's better.
Because of the reputation UT Health Northeast has as a world leader in radiation therapy, we've been chosen by TrueBeam manufacturer Varian as a reference site of excellence.
And these reference sites are places that exhibit an exceptional ability to manage and use the equipment and the technology and the software that they have. And they send people from all over the world into these reference sites so they can see how this place is doing it to help them influence their practice.
Cancer treatment professionals from all over North America and as far away as Great Britain and Israel routinely visit UT Health Northeast to learn more about our innovations in radiation therapy. This level of excellence also extends to our chemotherapy treatment area.
As we designed the facility with the patient in mind, the chemotherapy chair was very important. And as patients were always looking for a pillow or extra support, it's already built into the chair and can be removed and added easily. Another thing is that chemo patients typically are cold and need some extra blankets and heat. The chair actually it is a heated chair, as well as that it has massage.
Each patient is in their own room where they can have privacy, but also communicate instantly with the nurse responsible for their care, or with someone else if they choose.
In this private room with their own TV, patients then said that occasionally they like to actually get their chemo with a friend that has also has come down with cancer. And for that reason, we've actually put in these open doors that allow us to combine the 2 patients and put the rooms side by side.
This commitment to the highest quality care for our patients also extends to our breast center, which was recently featured in a local television news series.
I'm going to come right over here.
Christina Apple found her first lump 3.5 years ago. It happened not long after a family member was diagnosed with breast cancer.
It might be a little uncomfortable, but it shouldn't hurt. I'm going to take a picture now, okay? Okay.
Christina's first lump turned out to be normal, but her mother and aunt also battled breast cancer.
Hold your breath.
So that landed Christina in the high-risk category with mammograms every 6 months at UT Health Northeast's breast center.
When I went back for my second mammogram for the 6-month checkup, They found something in the left side, and that's when he said, okay, we're going to have to do a biopsy. And unfortunately, we had to have the mass removed, and they were wonderful with that.
Okay, we're all done.
CBS 19 reporter Dana Huey also focused on cancer research, including preventive clinical trials currently underway at UT Health Northeast.
Dr. Edward Sauter isn't just a cancer surgeon. He's a researcher. He's done previous studies with Celebrex. He says those results were promising in decreasing inflammation in the breast.
We thought that adding vitamin D, which has been shown to decrease inflammation as well, but works through a different pathway, would work together and be more effective together than either agent alone.
We had over 200 patients enrolled on a clinical trial this past year, which is outstanding. And each one of these patients plays a vital part as far as looking towards the future and how to reduce the incidence of cancer here in East Texas as well as nationwide.
From the latest technology in radiation and chemotherapy to our state-of-the-art breast center to groundbreaking cancer prevention research, UT Health Northeast is at the cutting edge of cancer treatment and prevention. And while each patient we see is cared for as an individual, every cancer patient's journey is designed to reach this day, ringing the bell of hope. A gift from our volunteers, the Bell of Hope is the signal to everyone within earshot that a cancer patient has completed his or her treatment. But more than that, it's a reminder that cancer can be beaten. And that's something we're doing every day at UT Health Northeast. Because healing from cancer feels better here, too.